Hi, my name's Daniel. I'm a veterinarian, 5 years since graduation. Currently I'm on a 3-month secondment in the emergency and critical care department at Peninsula Vet Care. We're kind of very spoilt in ECC in terms of the equipment that we have, the diagnostics, the staff that we have, the knowledge and the care that we're able to provide to kind of our hospital patients. GP can often be quite fast-paced and sometimes we don't have the time to kind of go into things in as much detail as we do in ECC. I would definitely encourage other vets in general practice to give something else a go. I think our profession's a lot broader than we think sometimes. We're not kind of just got the option of small animal general practice. ECC is one of the many other options that we do have, which is quite a different take on kind of working as a vet. It's quite a different role. There's different challenges, different responsibilities, and I think if you're looking to try something new, I think it's not as scary as it sounds. It's quite approachable and also quite interesting and challenging in different ways. I think the best thing about working at Peninsula Vet Care has been the team. I think the team of vets, specialists, nursing staff, reception staff, everyone's so supportive, helpful. We do really kind of work as a team. Everyone helps each other out. It's easy to kind of seek a specialist opinion on a complex case. I think that the wealth of knowledge in this building is impressive, and it's I feel like a member of quite a supportive, collaborative, focused team in this building. So I think that's probably the biggest strength. One evening we had quite a busy night. We had 2 large breed dogs present for gastric dilation and volvulus within kind of 30 minutes of each other. Both kind of very critical cases that needed like prompt intervention and surgery. So that was definitely a high-paced adrenaline moment for me. In the short time that I've spent in ECC, I've gained so many new skills that I'll be able to apply to all sorts of different aspects of my career. So I suppose how we approach a new emergency is really kind of very structured. So the nurse would come out first, triage the patient. They would check the kind of heart rate, respiratory rate, temperature, gum colour, and if there's anything very critical, that patient would then come straight out the back and receive emergency care straight away. If those things kind of do check out, that they would then wait, get triaged, and then see kind of the consulting vet. And then once we get those patients into hospital, we would then check their blood gas, make sure their lactate's okay and they're not either acidotic or alkalotic. And we go through everything step by step. So then run more bloods, ultrasound as appropriate for each case. So everything's kind of very much in a step by step fashion. So which kind of allows us to kind of prioritise the cases that we see so that the patients receive the care that they need at the appropriate time. I probably enjoy being the hospital vet. I think maybe a little bit more than the consulting vet, but I think both roles have their merit. I think managing complex hospital cases and managing their different needs, researching up on kind of what can be some kind of peculiar cases and working together with the medicine and surgery teams can be quite kind of interesting and rewarding. It'd be quite a big effort to make it through a whole night shift, but I do really like my coffee, so probably not a good thing, but I do have a short black fairly often. Do also like some chocolate as a bit of a sugar kick, so it's probably not the healthiest option, but it gets me through the evening.